Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I serve on the MS Society's Community Review of MS Research Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering questions and connecting you to resources. Today, we're talking with Dr. Sam Hooshmand about MS relapses, how to identify relapses, and strategies for managing them when they do occur. Dr. Hooshmand is the director of the Multiple Sclerosis Clinic at the Milwaukee Veterans Affairs Medical Center and assistant professor of neurology at the Medical College of Wisconsin. Dr. Hooshmand treats patients with multiple sclerosis and other neuroimmunological conditions. Welcome, Dr. Hooshmand, and thanks for being with us today.
Thanks for having me, John.
To start us off, can you explain what an MS relapse is? And then I'm hoping you can resolve a question that lots of people tend to wonder about by helping us understand whether an exacerbation, a flare-up, or an attack all mean the same thing.
Certainly. The technical definition of a MS relapse is a clinical episode with patient-reported symptoms and objective findings typical of MS that lasts at least 24 hours in duration. MS relapses typically start acutely to subacutely, meaning hours to days, and they ramp up over the next few days. In the context of multiple sclerosis, a relapse, exacerbation, flare, attack, all of these are used interchangeably, and they all mean the same thing. They're all referring to the phenomenon of sudden worsening of MS symptoms or the occurrence of new MS symptoms.
You know, we've heard from Danny, and Danny wants to know what causes MS relapses.
This is an area of ongoing research. We technically don't know exactly what causes an MS relapse. There's many factors that are thought to trigger an MS relapse, and certain research is associated with things such as postpartum status or exposure to certain medications triggering a relapse. But regardless of what the trigger is, a relapse leads to an inflammatory phase where certain white blood cells enter the central nervous system and cause damage in the form of inflammation, demyelination, or neuronal cell injury. And this leads to an impairment in signals within the central nervous system.
There are 4 types of disease courses associated with MS: clinically isolated syndrome, relapsing remitting MS, secondary progressive MS, and primary progressive MS. Do relapses occur in all 4 disease courses? And do relapses themselves impact disease progression?
So traditionally, relapses occur in all of those forms except for primary progressive MS. From a traditional standpoint, clinically isolated syndrome, relapsing remitting MS, and secondary progressive MS are part of a continuum of disease processes which occur typically sequentially. In clinically isolated syndrome, a patient has only had one relapse, and if they were to have another relapse, they would meet criteria for relapsing remitting MS, which is the most common form and associated with recurrent relapses. In a certain percentage of patients, people go on to develop secondary progressive multiple sclerosis, which is characterized more by continuous disease progression rather than relapses. Regardless of the subtype of multiple sclerosis, we know that relapses and accumulate and can cause disability over time.
We heard from Carla, who told us that she's been diagnosed with relapsing remitting MS, which is characterized by occasional flare-ups of symptoms. With the unpredictability of MS symptoms varying from day to day, Carla's wondering how to recognize when she's having a relapse, and are there strategies for catching potential flares early?
Yeah, Carla has a great question. This is something I'm frequently asked in clinic, and I tell my patients there's two things to watch out for that may be indicative of a relapse. One, a new neurologic symptom that you haven't experienced before that lasts over 24 hours, or two, a worsening of a pre-existing neurologic symptom that's more severe than your baseline. This is tricky enough that I often encourage patients to keep a symptom diary. And if there's ever any doubt about or question as to having an MS relapse or flare, to contact us in clinic, and we can help troubleshoot what the symptoms are and how what would be needed to be done further to help determine if it is a relapse.
Gina wrote in saying she's heard the term pseudo exacerbation. Can you explain what that is? And does a pseudo exacerbation have an effect on the central nervous system?
Sure. Pseudo exacerbation is a term used to describe temporary worsening of MS symptoms. It is not characterized by new inflammatory activity or damage to the central nervous system. But there's several factors that can cause a pseudo exacerbation. Some of these include stress, infection, dehydration, lack of sleep, overheating. But it's important to know that once the trigger is removed, the symptoms should resolve. And if the symptoms do not resolve, that would be concerning for an inflammatory process and needs to be evaluated further.
You know, I think you just answered what was going to be my next question from Candy, but I think it's worth asking just to get some clarification. Candy said that she's heard that stress can trigger an exacerbation. I think you just pointed out that stress may trigger a pseudo exacerbation. So maybe you can let us know if that's limited to pseudo exacerbations or whether stress can also trigger a relapse.
Sure, and this is an area of, I would say, debate and controversy within the multiple sclerosis field. There is some evidence, some research studies that suggest that stress itself can trigger an inflammatory relapse. However, it's typically stress triggers a pseudo relapse. What we do know is that stress can cause indirect effects on MS symptoms. Stress can disrupt your sleep, can impact your mood, and overall impact your well-being, which can temporarily worsen your symptoms. And it's really important to try, regardless of who you are, whether you're living with MS or not, to try to reduce your stress, as this will be better for your overall well-being.
Juanita tells us that she's 50 years old and she's going through menopause. She finds herself feeling overwhelmingly fatigued at times. Juanita is not sure if what she's feeling is a normal symptom of MS, if it's related to menopause, or possibly an MS relapse. She wants to know whether there's any tests to determine if she's actually having an MS relapse.
Yes, certainly Juanita's complaint is one of the most common symptoms of MS, which is fatigue. You know, some studies suggest over 80% of MS patients have fatigue. With this, it's very important to work with her clinician to look at, is the fatigue primarily due to MS itself or possibly a secondary factor? And one of the things that she raised was menopause. We see fatigue occurring in MS patients, sometimes due to their disease-modifying medication, sometimes due to nutritional deficiencies or impaired mobility. In terms of determining if she's having a relapse, one of the tools we use is the physical examination, but whenever fatigue's playing a role, we may have to employ the usage of an MRI machine.
Which actually brings me to my very next question. I'm wondering, does an MS relapse show up on MRI?
Yes, the answer to this is yes and no. So an MS relapse can show up on an MRI, but there's a lot of technical factors that go into it, such as the MRI strength. We know that the stronger the magnet, the more likely we are to detect MS lesions. The slice thickness of the images. We know that if you use thicker slices on image processing, you could miss a lesion. And then the location where we think the MS relapse would have occurred. One of the common MS symptoms we see, or syndromes, I should say, is a process called intranuclear ophthalmoplegia, which is a misalignment of the eyes. This occurs in the brainstem, and it's frequently missed on MRI because of how small the lesion is. So we need to interpret the MRI with caution and use it in a clinical context.
Let's switch gears a bit and talk about managing and treating MS relapses. Is there anything a person with MS can do to prevent an MS relapse?
Certainly, there's a lot of things that MS patients should do to prevent a relapse. One of these is employ a healthy lifestyle. No matter what form of MS you have, what subtype, where you are in your disease state, this is very important. And research has shown regular exercise, a balanced diet, adequate hydration, avoiding smoking, all would decrease the risk of a relapse and progression for that matter. The other important thing is regular monitoring, working with your healthcare provider to make sure your disease activity is not ongoing, and doing everything you can to prevent a relapse. And one of the main methods we use for this is disease-modifying therapies. You know, there's now in 2023, there's over 20 different FDA-approved disease-modifying therapies. Not all options are right for all patients, but working with your healthcare provider can help identify what would be a good disease-modifying therapy for you and for your MS.
How important is early treatment if someone thinks they are experiencing a relapse? Is this something they should be going to the emergency room for?
I think early treatment is important. However, not every MS relapse requires you to go to the emergency room, because the majority of MS relapses, the vast majority, are not life-threatening. I would rather suggest patients call their healthcare provider, talk to them about their symptoms, their duration of symptoms, their severity of symptoms, and via that mechanism, they would be maybe better suited for treating the patient rather than having them go into the emergency department, which may not be familiar with the patient's history, or in some cases with multiple sclerosis.
Brian told us that his doctor put him on steroids when he had a relapse. Can you explain how steroids help? And are there other treatments or strategies that can be beneficial when someone's going through a relapse?
Yes, so Brian got steroids, which is, considered the first line treatment for an acute exacerbation or acute relapse in multiple sclerosis. Steroids work primarily in two ways. First, they decrease inflammation, and second, they're lymphocytotoxic, meaning they kill certain white blood cells that are involved in causing the inflammation and demyelination. Steroids are in the United States given typically in IV or oral forms. The IV formulation is usually methylprednisolone, or also known as solumedrol, and it's given at a high dose. And the oral form, it's typically given in the form of prednisone, which is also given at a high equivalent dose. This is much higher than people would have for other disease processes. The dose of prednisone is typically 1,250 milligrams, so much higher. In addition to corticosteroids, two other treatments that are used are treatment called ACTH, which is an intramuscular injection, although the limitation with this is getting it approved by insurance companies, or plasma exchange, also known as PLEX, which is a procedure where the patient would have their blood filtered and antibodies removed. The appropriateness of these treatments should be discussed with your physician, as all of these treatments can have potential risks and potential benefits.
I think I heard you begin to answer this next question. Maybe you can expand on that a bit. We heard from Jake, and he's wondering if all exacerbations require treatment.
No, not all exacerbations require treatment, and this is often not understood by some healthcare providers. And the reason being is not all exacerbations are severe. And what our current data, although there should be more research into this, shows that the treatments help expedite your recovery, and they don't necessarily change long-term prognosis. It's very important to have a discussion with your physician and weigh the risks and benefits, as they would be able to take into account your medical comorbidities, other medications you are on, and the availability of the treatments in your area.
Can a person fully recover from an MS relapse? And are there specific strategies that can help people get back on track?
Sure, yes. Some people do fully recover from an MS relapse, but unfortunately, some people do not. Partial recovery is not unusual. One of the more dissatisfying things is that while MS attacks can come rather quickly, the recovery can be prolonged. It's important to help expedite your recovery to try to engage in things such as therapy and working with your healthcare provider to identify if you would need physical therapy, occupational therapy, or speech therapy is the best course of action. In addition to that, having a strong support network can make all the difference in MS recovery.
You know, there's no getting around the fact that relapses can be scary. Not only does a person not know when a relapse is coming, but they also don't know what effect that relapse is going to have on them in that moment or in the future. This can have a real effect on someone's sense of well-being. And Mark is wondering if you have any tips for getting through a relapse without letting it live rent-free in your head.
Sure, this is definitely very challenging and can certainly bring a lot of stress to those living with MS. So while it's easy for me to say, worrying about a relapse occurring isn't going to prevent it from not occurring. So it's best to, work with your healthcare team, identify ways to get in contact with them that would be to discuss what your symptoms are and to identify if those are a relapse, and also to have a strong social network through various nonprofits, local branches of the National MS Society, and, family and friends, and relying on them to help you get through the relapse.
Well, you shared some great information with us today, Dr. Hooshmand. What would you say are the top 3 takeaways that you'd like our viewers to remember?
So number one, if you suspect you're having a relapse, I would contact your healthcare provider. It's very challenging for both patients and physicians to determine if you're having a relapse or pseudo relapse. And the best way is to discuss what your symptoms are and possibly do further testing. The second is not everybody needs a treatment with multiple sclerosis relapse. The treatments have their own risks and benefits, and they need to be discussed in detail with those living with multiple sclerosis. And finally, if you've had an acute treatment and didn't have a good response to it, it doesn't mean that there isn't other acute treatments. Corticosteroids are our main first line therapy, but there are other treatments that have been shown to be effective, such as plasma exchange and occasionally ACTH.
Well, thank you for sharing your expertise with us, Dr. Hooshmand. Let's continue answering questions from our viewers. Are there parts of the body that are most commonly affected or certain symptoms that are most common during an MS relapse?
Yeah, this has been investigated in a big research study back in, I think, 2014, where about 15,000 MS patients were surveyed, and they found that the MS symptoms most common to occur are sensory, motor, or visual. And whenever we look at these symptoms, they can occur in the common places we see it in the central nervous system. So one being the optic nerve, two being the brainstem or cerebellum, which can result in facial sensation abnormalities or incoordination, and three being the spinal cord, which can result in impairments of motor ability, and it can also affect bladder, bowel, or sexual dysfunction.
Parker shares that they've had 2 relapses since they were diagnosed in 2017. And Parker said each time their doctor made them get a urine test before being given steroids. They want to know why that is.
I would assume Parker's doctor is doing that to ensure that there isn't a concurrent urinary tract infection. So urinary tract infections can be more common in those living with MS due to innervation issues to the bladder from the spinal cord. And it is important that if there is a urinary tract infection, that be addressed, because that may be causing the worsening of symptoms, and it may be more consistent with a pseudo relapse.
Well, I want to thank everyone who submitted questions, and thank you, Dr. Hooshmand, for being with us today.
Thanks for having me, John.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please be sure to visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups. You'll hear about ways that you can get involved, and you'll learn about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Hooshmand for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Sam Hooshmand and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.